Alright.
You can cut and paste on this.
Yeah, I can cut and paste on this.
Hey, I tell you, I got a million of them, folks. Who was that lady you were with? That was no lady, that was my wife. Hey, I got a million of them.
Alright. So basically the scenario is we're just going to chat like you and I are sitting down for the first time talking about Medicare and yada 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 and go over the choice options here. So, alright. Well, Richard, I really appreciate you taking some time to sit down and visit with me a little bit. Again, here's my card. I'm Darrell Russell. I'm an independent agent. And you signed the scope of appointment form, so of course you're aware that I am an agent and I can be compensated based on your enrollments in a plan. But before I get started, I just wanted to kind of share a little bit about myself, who I am, and kind of where I've been from. I've been an agent for going on 20 plus years, so I'm not some kid wet behind the ears. And I've been working with people on Medicare plans for about the last 16 years, so I feel pretty comfortable that I know my way around the block, so to speak. But how well do you understand Medicare and the Medicare program, or do you have any specific questions you'd like me to kind of address right away? Or
No, I don't, because I don't understand it.
Okay.
Just turning 65 and I have no idea what to do.
Well, let me go over a couple things here to kind of help set the stage here, kind of give you some basic understanding. And my big philosophy is, if you're like most people when you're turning 65, you get so much stuff in the mail, it can be kind of overwhelming.
Exactly.
And you've probably talked to different agents on the phone, and maybe you've gotten conflicting information from different people here. So I always like to use the Medicare and You booklet. Okay, so I'll go through a couple things in here, and is it okay if I take notes?
Oh, sure.
Okay.
Yeah.
Now it's Richard. You go by Richard, Rich, Dick. What do your friends call you?
A lot of names.
A lot of names. Okay. Well, what do your friends call you?
Richard.
Okay. Okay. So is it okay if I call you Richard?
Sure.
Perfect. Well, basically here in the Medicare and You, and you'll get this booklet every fall. In the very first section here, it talks to you about your Medicare A and B, okay? So here it tells you that there are two main ways to get your Medicare coverage. Original Medicare, I call it your red, white, blue Medicare card,
Right.
or a Medicare Advantage. And it gives you a little chart here to kind of help you understand this a little bit.
Exactly.
So I like to kind of draw a line in between these two choices because it's either or. You're either on one side or you're on the other.
Right.
Some people call it the real world versus the twilight zone, if you will, so to speak. But basically, you start off with option one. And this is where you would use your original Medicare card, your red, white, and blue card. And have you gotten that in the mail already?
Yes.
Okay. So you've got Medicare. It has two parts. Part A is your hospital coverage. So that's all your brick and mortar. If you're in the hospital, what have you. And for most people, if you worked at least 10 years in your life or 40 quarters, you don't pay any monthly premium for Part A. And then Part B, that's your outpatient services, doctor's visits, hospitals, or same-day surgeries, lab work, ER, that type of thing. And in 2015, the standard premium for that's $105, $104.90, but basically $105.
If something came out that's going to go up.
They are talking that is set by Congress every year, so it could go up for next year. Generally speaking, they'll announce that premium change here. Should be coming up pretty soon with this being September.
What do you think Congress is going to do? I've heard it's going to go up 45 to 50 bucks.
There has been some speculation that it could go up quite a bit, but we'll wait on that and see what it's going to be. And unfortunately, as an insurance agent, I have absolutely no control over what that is. Now it can be higher based upon your income. So if you made more than $85,000 as a single, $170,000 as a husband and wife, they do actually increase the Part B based upon income in that regard. But your Medicare A and B together gives you full coverage under Medicare. Now there are some deductibles, like it's a little over $1,200 just to go into the hospital under Medicare, and then you'd be responsible for that.
Is that first day, second day?
With Medicare's deductible, it's $1,200 for one day in the hospital, up to as many as 60.
Okay.
Now, granted, most people don't stay in the hospital 60 days in a row, but it's kind of a convoluted system there a little bit.
Okay.
And then Part B has its own separate deductible. You only meet that once in a calendar year. It's basically $150. $147 is the exact amount, and that could change for next year as well. And then after that, I think most people understand that Medicare is basically an 80-20 proposition. So they would pay 80% of what they approve, and then you would be responsible for the other 20%. Okay? Now, since original Medicare works just fine, there's no networks of doctors. As long as the doctor or hospital wants to build the Medicare plan, you can use them. You don't need any prior authorizations or referrals and that type of thing. But there is no drug coverage. So if you want Part D prescription drug coverage, then you need to decide to apply to a Part D plan. And these all run through private insurance companies that are contracted with Medicare. So you'd have your red, white, blue card and pay the Part B premium.
Right.
And then to have drug coverage, you'd enroll in a Part D plan and have another card and then pay its premium.
Right.
Thirdly is decide if you want to buy a Medicare supplement. Okay. Now these are all standardized by law. And you can buy a supplement that will either pay everything that Medicare leaves left over for you, or you can maybe have a little bit left over. But typically speaking, here in Kansas, you're looking at about a $50 premium for the most common Part Ds, and about another 150-ish, give or take, on a supplement. So
You
you
call that the Medigap.
Yeah, Medicare supplement or Medigap is kind of potato. It's the same thing, just a little different name.
Okay.
So if you go this way, you'd have a card and a premium, a card and a premium, and a card and a premium. It works great, but in addition to your Part B, you're going to be spending roughly about another $200, give or take. But you have no networks. And if you do a Plan F supplement, which is one of the more common ones, basically you just go in and out of the doctors and show them your cards and everything is going to get taken care of. It's just paying that big premium every month.
So that's a monthly premium.
So you'd be roughly about another $200 plus your Part B, so about $300 a month.
So if I don't use anything, I still pay it.
That is correct. That's kind of how that works. Okay. Now your other option, would be to go into a Medicare Advantage plan. Okay. Now Medicare Advantage, this is what's called Part C, and these are all offered by private insurance companies. Here in the area, we're going to have 5 for next year. And what it does is it combines your coverage for your hospital under A, your doctors under B, and most plans include the prescription drug, all built in on one card. Okay. And if this makes sense for you, it actually replaces your red, white, blue Medicare card. What I mean by that, if you like this plan, you only show your Advantage card to your doctors and hospitals. But they do typically use networks. Okay? So you may have either an HMO plan, which means you have a very tight network of doctors and you can't go out of it unless it's an emergency. Or there are PPO plans where you have a lower copayment if you use in-network doctors, but if you had to go to see a doctor that wasn't on the list, you still can, you just pay a little bit more.
Okay.
The big difference is if you do an Advantage, number one, they receive federal funds for each person that joins the plan.
Okay.
And so your Part B premium that comes out of your check automatically is also sent to an Advantage company if you choose to enroll in that plan. So what you'll see is there are a lot of Medicare Advantage plans that may not charge you any monthly premium,
Right.
or in some cases maybe 20, 30 bucks. And if you do that, you don't need a separate card for prescription because it's built in.
Okay.
And you don't need to pay that monthly premium for a Medicare supplement. Okay? So you pay your Part B, the $100, and again, we can find you some zero premium. So you're only paying out $100 a month, basically your Part B instead of $300. The difference is you'll have networks that you have to work with, and you will have co-payments when you go to the doctor, when you go to the hospital. And so what I like to tell people is it's really kind of a difference in how your philosophy is. Medicare with a Part D and a supplement is very convenient, no networks, but it's kind of a prepaid use it or lose it proposition. In other words, if you go to the doctor 50 times in a year and because of your premiums you don't have to pay any co-payments, you feel like a rocket scientist. Boy, that was really smart of me to do that. But if you only see the doctor maybe 4 times, you know, you've paid a large amount of premium every month just to not have to see that that
Okay.
doctor expense.
Right.
So it becomes a math question. If you do the Advantage and you're not putting an extra $200, give or take,
Mhm.
out every month,
Mhm.
is that money going to be enough to offset the co-pays
Mhm.
that you'll have
Sure.
and working within the networks?
Okay.
So this is very convenient, prepaid, but you do use it or lose it. On this side, it's more of a pay-as-you-go for
Mhm.
what you use,
Right.
and if you don't use it, well, then you don't pay
Don't
anything.
pay.
So of those two, is there one way that maybe is more appealing to you that we should kind of focus on more?
Yeah, what I need to decide is how many times do I see a doctor in a year, and how many times, when's the last time I was in the hospital?
That could be helpful. That
That
could
will
be
tell me
helpful.
kind of what to do. Spending over here a predetermined amount every month. If I don't use it, then, it is insurance, but over here is pay as you go. There could be months, I haven't seen the doctor for at least 10, 12 months ago, once a year. Last time in the hospital was 2 or 3 years ago. So, kind of makes sense maybe to look at that for sure.
Well, let me give you a little bit more information on the Advantage plans and kind of how that works.
Okay.
Here in the Medicare booklet, in the back, there's a whole section on Medicare Advantage.
Right.
I've got a little bit older book here, but here it talks about Medicare Advantage, okay?
Mhm.
And here again, it tells you on this page that Medicare Advantage plan, like an HMO or PPO, is another way to get your Medicare coverage. If you join an Advantage plan, you still have Medicare, but you get your A, hospital coverage, and your B, medical coverage from the Advantage plan, not original Medicare.
So I don't lose my Medicare.
No, and that's why I said that if this makes sense for you and you decide to enroll, whichever company you pick is going to send you an Advantage card.
Okay.
And for billing purposes, it is your Medicare card.
That's it.
So whenever you're at the doctor, the hospital, even if you go somewhere to get a flu shot and they ask for your Medicare card,
Mhm.
when you're on an Advantage plan, the only card you show them is your Advantage plan. Now, I tell everybody to keep your red, white, and blue Medicare card safe, but
Mhm.
keep it at home for two reasons. Number one, if you're on an Advantage plan, you don't want to give your doctor your red, white, and blue card,
Right.
because if he bills it, Medicare is going to reject the claim and send it back to the doctor saying, Richard's on an Advantage plan, you need to rebill that.
Right.
And you'll also get a statement from Medicare that looks like the whole bill's been rejected.
Mhm.
And once you get done being madder than a wet hornet and calling me and yelling at me, I'll remind you to look at the bottom of the statement where it says, hey, your doctor
All right.
billed the wrong place, he needs to rebill your Advantage plan.
Sure.
Secondly, even if you don't do an Advantage, I'd like you to think about not carrying your red, white, and blue card in your billfold, and here's why. Have you looked at your red, white, and blue card? What number's on your card?
Social Security.
Exactly.
Mhm.
So in this day and age, if you were to drop your billfold and I found it and it had your driver's license and your
Mhm.
Medicare card in there, unfortunately, there's a lot of really bad things I could do with your name, address, birth date, and your social security number. So you may want to think about, regardless, maybe not carrying your red, white, and blue card just for that reason.
Mhm.
And Congress is working on changing that Medicare number, so it'll be just like a made-up number, so you don't have to worry about that.
Well, they are.
But they haven't got that quite done yet.
Mhm.
Okay. Now, the important thing to realize is that in all Medicare Advantage plans, you're always covered for emergency and urgent care.
Mhm.
Now, what that means is most of the Advantage plans are network-based. So you'll have either an HMO network of doctors or a PPO network, and they're all here in Kansas City.
Right.
But if you're like most people on Medicare that I talk to, you may take trips from time to time
Right.
down to Florida or go see grandkids in Colorado or something like that. And if you were to fall and sprain an ankle, or maybe have a fish hook in your finger while you're fishing a Colorado stream, well, that's an emergency or maybe an urgent situation. where you need to go see a doctor. Well, if you're in Colorado, you're not going to get in the car and drive 10 hours to come back to Kansas City to see a doctor.
Right.
So what Medicare means by you're always covered for emergency and urgent care, they mean the doctors, when they sign up to bill Medicare, and the Advantage plans companies, when they sign up to do these plans, agree that if you're out of your home area, away from all your network doctors, if you get hurt, you get sick, you have a heart attack, you have something considered emergency or urgently needed care, you can go to any doctor, and the doctors agree to treat you and bill the Advantage plan, and the Advantage plans agreed to pay the bill because you can't control that. Okay?
What about international?
Most Advantage plans will give you some coverage for emergencies while you're out of the country, but it's typically like, let's say you go to Greece and you have a little too much ouzo dancing the aura and you sprain your ankle in Greece. Well, you're going to go to a Greece hospital, they're not going to be able to bill the Advantage plan.
Right.
So typically how it works is you'll have to pay the bill yourself, save all your receipts, and then when you come home, you could submit them
Get
for
reimbursed.
Either that, or you can look into your travel agent and see if they can get you a little foreign travel insurance to cover you for medical and that type of thing.
Okay.
The main thing that I always like to stress is that how these plans work, because this still throws people when we start talking about the Advantage plans when there are no premium or maybe a $20 or $30 premium. It's always in the back of my mind that you can't do all this for no money or a couple bucks a month. And here it tells you that Medicare pays a fixed amount a month for your care each month to these companies. So I know that the Advantage companies get several hundreds of dollars. The exact amount I don't know, it really doesn't matter. But Medicare sends them a premium check, for lack of a better term, every month. Plus the money that comes out of your Social Security for Part B of Medicare is also going to the Advantage plan if that's what you choose.
Gotcha.
So it's not like they're no cost, they're just not charging you any more than you've already paid in and what the government pays them. Okay? Now on the other side here, it goes over a little bit more, like in the Kansas City area, we have HMO plans available and we have PPO. So again, with an HMO, you can only go to doctors or other healthcare providers or hospitals in the plan's network. Now, there is an exception for an emergency. Okay, so like if you had a car accident and they took you to, and you were in an HMO Advantage plan, and the ambulance took you to a hospital that wasn't in the network, well, because that's an emergency, the plan is going to have to pay that bill for you. Okay? But normally speaking, if you just went to a doctor that wasn't in the HMO list, you're going to be responsible for that entire bill. So if you choose that type of plan, it's very important that we make sure your doctors are in the network. Okay? A more popular plan are the PPOs. Okay? These tend to have lower cost. The PPOs you might have a little bit of a premium for, but in the PPOs you usually have a much bigger list of doctors you can see and hospitals. And if you go to the doctors on the list in network, you have a lower co-payment. But if you do need to see a doctor, maybe a specialist for some skin cancer or something like that, you can go to that doctor as long as he's willing to bill the plan, and you'll still have coverage. You're just going to pay a little bit more. Okay. So out of those two, which is what we have available in the area, if you were to think about that, which one would be more appealing to you, an HMO or would you like the PPO option?
Probably the PPO.
Okay.
It depends on, you mentioned 5 companies. How many of the 5 companies have the PPO?
Well, currently in the area, there's 2 companies that offer PPO. Coventry offers a PPO and Humana does. Okay. Of the 2, Coventry has the lowest monthly premium and probably one of the larger of the 2 in terms of networks, and it's very, very popular. So, do you want to take a look at that, or do you want me to go over the Medicare supplement with that bigger premium?
No, the PPO.
Okay. Well, let's go ahead and, if you don't mind, before I do that, it's important to kind of know where your doctors are, because that'll kind of help us pick where we want to go in terms of plan. Okay. So you use Johnson County?
Yep.
Okay.
Olathe.
Medical? Okay. Any other specialist, heart doctor, bone doctor, anything like that?
No.
Do you see a chiropractor from time to time?
No.
Okay.
I don't, fortunately.
And I'll go over the plan-specific details. I'll show you the formulary. Formulary is the list of drugs. If you have any specific drugs that you want to make sure are covered, we'll need to check that as well.
Sure.
And we'll kind of go from there. So,
All right.
all right. Well, at this point, I'm going to go ahead and look up your doctors, and then
Gotcha.
we'll take a look at the specific plan.
Sounds good.
Bingo.
Thanks.
Hoorah! Hoorah!